Hi, welcome in. I'm Dr. Seb. Are you here for the cranial nerve exam? Yeah, okay. What is your name? Let me make sure I have you pulled up here. Okay, and the spelling for that? And your date of birth, please? Alright, that would make you an Aquarius? Okay. Alright. So, a few questions for you first before we get into it. Okay. To start off, have you ever had a cranial nerve exam done before? First time. Okay. So this is a very easy test, nothing to be stressed out about. We are essentially going to be testing out your cranial nerves and your senses. So that'll be your sense of touch, smell, taste, your hearing, and your vision. So we'll be doing all that very soon. Some questions that I need from you before we can get started. Do you have any medical conditions, pre-existing medical conditions that I should know about? No. Okay. Are you taking any medications, vitamins, supplements, herbs? Okay. And the dosage and frequency. And what is that for? What is that treating? Okay. Okay. Do you have any allergies? No? Okay. Latex? Nothing? Okay, good. Especially since we're going to be doing some smelling and tasting, I want to make sure that we're in the clear and have no allergic reactions. So no allergies, that's good. Do you smoke or drink? And if so, how often? Okay. Okay. And any adverse symptoms that you're experiencing? All good? Perfect. And just to make sure, have you had cough, trouble breathing, a stuffy nose, sneezing, anything like that? Fevers? No? Okay. Good. Alright. I think that means we're in the clear. Okay. I have this notebook. So here I'm going to write down your results, just take notes throughout the exam. So if you see me writing, that's what this is. So, here we go. Start off. Okay. So, to start off, I'm going to take a look at your eyes with this light, and we're going to go through your vision first. That's what we will be testing first. So incoming bright light, right? Is that too bright or is that okay? All right. So to start off, I'm just going to take a look at your eyes. Actually, before I start, I'm gonna put on my gloves. Okay. sure. I have sanitized my hands, but it's always good to be safe. Okay. Can we get started? I'm going to get a little bit closer to you. I might touch your face a little to open up your eyes. Is that okay? Okay. So I'm gonna start with the right eye. Just open them wide. Thank you. Okay, just checking the dilation of your pupils. Okay. Now this eye. All right, good. Next, I'm going to ask you to look up. Okay, just pull down a little bit to get a better view. Okay, this eye. Okay. All right, I'm gonna ask you to look to the right. Good. Okay, and now to the left. All right. Now I'm going to ask you to follow my light, right? To be easy. Okay. Follow the light, you're doing great. A little faster. All right, now I'm going to have my fingers here. I'll be moving both at the same time. I'm gonna ask you to keep looking at the light and ignore my fingers. Okay? Ignore my fingers and follow the light. You're doing great. Okay, that was great. For the next part, I'm going to ask you to look straight at my nose and I'm going to test your peripheral vision. You are going to let me know without moving your eyes or your head when the light is no longer in your field of vision. Okay? So just stare right here at my nose. Okay. Good. This side. Perfect. For the next part, I'm going to hold up my fingers and while still looking at my nose, you're going to let me know how many fingers I'm holding up. Okay, I'm gonna start with one hand and then we'll move on to two. Okay. So. Good. Good. Now, add two. So, remember, keep looking at my nose. Cannot look directly at it. Don't move your eyes or your head. Just from your peripheral, let me know how many fingers I'm holding. Good. job. For this next part of the eye exam, we're going to be doing a color test. So I have a bunch of markers that are different colors, and I'm gonna hold one up and you're going to let me know what color it is. Okay, all right, pretty simple. So start off. What color is this marker? Red. Okay, good. This one. Blue. Okay, good. This one. Yellow. Good. Colors this. Purple. Good. How about this one? Green. Good. We have, we're gonna do 3, 4 more. 4. This one. Orange. This one. Brown. Okay, good. This one. Pink. Good. And the last one. Color set. Black. Perfect. Good job. You passed with flying colors. Goes back. There we go. All right, and that is it for the eye exam. You did great. I do not see any issues with your vision, so all good there. The next part, let me actually take a quick break to write down the results into my notebook, and then we will continue with the next part. Okay. So, so for the next part, we are going to do, let's do hearing. Let's do hearing. Okay. So, the first thing I am going to do is I'm going to use my hands. I'm going to make a sound, and you're going to tell me which side you hear it on, okay? So close your eyes. Close your eyes. Okay, no peeking. And I'm going to make a sound, and you just raise your hand, which side, okay? Good. That's both at the end. Good. All right. And for this next part, I'm going to whisper a word. I'll whisper it, say it 2 or 3 times, and you let me know what I said, if you could hear what I said. Okay? So again, close your eyes. I'm going to get a little closer. I'm going to whisper on each side, okay? All right. What should I start with? Okay. Lollipop, lollipop, lollipop. Lollipop, okay, good. Speaker, speaker, speaker. Speaker, okay. Bottle, bottle, bottle. Bottle, good. Marker, marker, marker. Marker, okay, good. Notebook, 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 notebook. And I'll do one more. Let me think. Okay. Dinosaur, dinosaur, dinosaur. Dinosaur. Okay, good. You passed that. That's it for the hearing test, so all's good there. I'm gonna write my notes and then we'll move on to the next part. Okay. All right. For the next part, we are going to be testing your, I guess, sense of touch. So to start, I am going to first examine your face. I'm going to get really close. I'm going to touch your face. I'm going to, press, see if, and check your lymph nodes. See if there is any pain. You let me know. I'm gonna apply a little bit of pressure and you're going to let me know if you feel any pain and if you can feel my fingers. Good? Okay. And let me know which part of your body I'm touching or your face I'm touching. We're gonna start here. Okay, your temples, no pain. Check here. Good. And do your jaw. Okay. And then right here. Your neck. Here. Your shoulders. Okay, no pain. Good. Let me do your lymph nodes super fast. Any pain there? No, there's no inflammation or anything like that, so it's looking good. For this next part, I'm going to ask you to close your eyes again, and I'm going to tap different places in your face, and you let me know again if you can feel it, where you feel it. Good. Okay. So close your eyes, make sure your eyes are closed. Forehead. Toe. Other toe. Nose. Cheek. Jaw. Cheek. Jaw. Neck. Shoulder. Cheek again. Forehead again. All right, perfect. You can open your eyes again for a little bit. I'm going to do a quick sharp versus dull, but do not be alarmed. It's not actually going to be sharp. It's not going to hurt. It's more like, it's just to test if you can feel the difference between something very soft and something a little more pokey is how I would explain it. It's not going to hurt, just a little poke. So for this part of the test, I have 2 objects. I first have one of these markers, and see it has a little eraser top that is very, very soft. Very soft. I can touch your face a little bit with it, and you let me know how you feel it. Soft, right? Okay. And the next one I'm going to do is this pen. I'm going to poke you with the end of it. Again, it should feel different, so let me know if it hurts, if you feel any pain, if you're all good. Okay? So I'm going to... Doesn't hurt, right? But you feel the difference? Okay, good. So I'm going to have you close your eyes again, and I'm going to touch you with either one of these. Once you feel it, you tell me if it's sharp or dull. Okay? Okay. So close your eyes, close your eyes, close your eyes, close your eyes. Soft. Okay. Sharp. Good. Soft. Soft again. Good. Sharp. Sharp. Soft. Okay. I think that's it. You can open your eyes. You did great. You could feel everything. So that's good. It's a good sign. Your sense of touch is intact. It's all good. All right, so let me take my notes again. Thank you for your patience throughout this process. For this next part, I think this is the more fun portion of the exam. Obviously, everything has been really chill, right? Yeah. But I think this is the most fun. This is your sense of smell and your sense of taste. We are first going to do your sense of smell. Okay. All right. So I have here, I have 5 scents, so you are going to let me know what you smell. I'm gonna have you close your eyes again, of course. In just a second, I will let you know, and you will tell me what you smell, okay? All right, so let's start with this one. Let's do this one, okay? Close your eyes, close your eyes, close your eyes, close your eyes. Okay, no peeking. So have it right here. Okay, you smell this. Take a deep breath. What was that? Mint? Good. Peppermint is the specific, but you got it. Good job. Alright. For the, let me check off that you got this. Okay. For the next one, let's do this one. I could do better tapping sounds. No nails, so. Wow, I haven't opened this one yet. That's crazy. I hope you didn't see the label. Your eyes better be closed. Yeah, closed. Go. Take a deep breath in. One more. All right, what was that? Tea tree. Good. Good job. Okay. The next oil. Let's do this one. This is one of my favorites. Okay, eyes closed, eyes closed. Okay, take a deep breath in. One more. Orange, citrus. Okay, good job. This was sweet orange, so you got it. All right, next one. We're almost done. This one and one more. Okay. Take a deep breath in. Got it? Eucalyptus. Good. Good. Yeah, you got it. You didn't need to hesitate. All right, and our last one, which is my personal favorite of these scents. If I can get it out. There we go. Okay. So good. Okay. Eyes closed, eyes closed. Eyes closed, eyes closed, eyes closed. Take a deep breath in. And one last breath. All right, what was that? Lavender. Good, 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 good. All right, you got them all. Let me write everything down. You got the peppermint. You got the tea tree. The eucalyptus. Orange. And the lavender. Perfect. And now the last portion of our exam, the taste portion. So this should be pretty fun. I also have 5 different flavors of things, and you are going to let me know what they are. I'm just writing them really quick. So again, eyes closed. I'm gonna start. Okay, so I'm just gonna have you open your mouth pretty wide, stick your tongue out a little bit so I can place the drops. Okay, so Ready? I'm gonna do 1, 2, 3. Okay, now you can taste that and let me know what you think it is. You got it? Strawberry. Good job. Okay. Right, for the next one, let's do this one. So open your mouth again, stick your tongue out. Okay. You have 1, 2, 3. Okay. So let me know. Taste that, feel that around. Vanilla. Good. Good job. Okay, let's do this one next. Okay. Open your mouth. Okay. And 1, 2, 3. Cherry. Good. Good job. 2 more. Almost done. Do this one. Open wide. Okay. 1, 2, 3. Okay. What was that one? Chocolate. Pretty easy, right? Yeah. That's great. And the last one, I will give a warning that it's a little bit of an intense flavor, so just don't want it to catch you off guard. Okay. Okay. Open wide, your last one. 1, 2, 3. All right, and what is that one? It's sour, right? Yeah, lemon. Good. Good job. And that was the last flavor and the last part of the exam, which concludes the cranial nerve exam. How are you feeling? Good, right? It's really easy, chill, a little relaxed, a little tingly. Yeah, we get that pretty often. This really does help us relax and helps with sleep. So I am glad that you enjoyed this exam. You are now free to go. I hope you enjoy the rest of your day or night and come back to our clinic soon.